Hey guys, this is Dr. Avni from drteeth. So after successfully completing our complete denture series, we are now going to start fixed dental prosthesis series. So today's session is about the introduction to fixed dental prosthesis. In today's session, we'll study about the various terms that are used in relation to fixed dental prosthesis, parts of fixed dental prosthesis, and also about the classification that is most commonly used. So let's get started. Let's start with the introduction, that is the definition. The definition of fixed dental prosthesis. So, any prosthesis that is luted, screwed or mechanically attached or otherwise secured to natural teeth, tooth root or dental implants or abutments, which is ultimately going to furnish the primary support for the dental prosthesis, and it ultimately restores the teeth in partially edentulous area. That is, it is going to restore in the missing area. It is going to restore the tooth in the missing area by taking support from the natural teeth. And this prosthesis, it cannot be removed by the patient. It can only be removed by the dentist. A patient cannot remove it. So that is why it is fixed. Now let us see what are the various terms that we use. First one is crown. So what is a crown? A crown, it is a extracoronal restoration that is cemented to the natural tooth. The primary function of a crown is to protect the underlying tooth and to restore the form, function and aesthetics of the tooth. The crowns, it may be clinical crown or anatomical crown or artificial crown. The crown, it can be covering the whole tooth structure, which is the full coverage or full veneer crown, or it can be partial coverage crown or partial veneer crown, in which it will be covering the tooth structure partially, not completely. Not all the surfaces will be covered. So this is crown. Now let us see what is veneers. So these are prostheses. So in this picture you can see this is the veneer and it is cemented to this part of the tooth. So veneers, they are the prostheses. They are made up of ceramic. They can also be made up of composite, and they are used as thin layer over the facial surface of the tooth. So this is the facial surface of the tooth, and veneer, it will be a thin layer which will be cemented to the facial surface of the tooth. Primarily, veneers are used for aesthetic reasons. After this, we have inlay and onlay. So what is an inlay and what is an onlay? Inlays, they are intracoronal restorations. That is, it is within the tooth structure and it is used for medium-sized single tooth proximo-occlusal regions or gingival regions. They are usually made up of gold alloy or ceramic material. So this is inlay. Now what is onlay? Onlay is also an intracoronal restoration and it is used to restore a more extensively damaged posterior tooth structure. As you can see in this picture, the tooth structure that is being damaged is of large amount and that is being restored by an onlay. Now let us see what are the different parts of prosthesis, fixed dental prosthesis. So first one is abutment. So this is the abutment. Abutment is any tooth, root or implant which gives attachment and support to the fixed dental prosthesis. So it can be a natural tooth or it can be an implant or it can be a root, and it will basically give support to the prosthesis. So this is the abutment. Now what is pontic? So pontic is the part of the fixed dental prosthesis which is going to replace the missing tooth. So as you can see in this picture, this is the missing tooth over here. And when this prosthesis will be cemented on these two natural teeth, This part of the prosthesis will be replacing the missing tooth. So that is Pontic. Let us see what are connectors. These are the connectors. Now connectors, they can be fixed or they can be removable type. So connectors, they are the connection that exist between the Pontic and the retainer. So we'll see what is a retainer now. For now, this is the retainer. So for now, this is the connection between the two. The Pontic and the retainer will be connected by a connector. And finally, this is the retainer. So retainer is the part that will go and cement onto the abutment. That is the natural tooth or implant or root. It can be anything. Now let us see what are the indications of fixed dental prosthesis.